Health Talk Live with Liz, sponsored by TriHealth.
Hey, good afternoon once again. Hard to believe it is almost time to head back to the ballpark. And opening day, believe it or not, a little more than a week away. Cincinnati Reds and TriHealth are teaming up to make sure all the fans are safe. And so we asked them just how they're working together to make this all happen.
In order to get back to limited capacity, we've had to really have our numbers of vaccinations significantly increase, which they had been over the last couple weeks. We're getting more and more vaccination now with J&J coming online. We're starting to see significant increases in the amount of vaccinations. So I think that with the careful planning that we've done here at the stadium, following CDC guidelines, allows us to have had fans come back to watch the ballpark, watch the ball team.
So are you feeling like what you have here can help care for the fans in just about any circumstance?
Absolutely. We have 3 aid stations here. We have the best paramedics and EMTs here in the city. We have board certified doctors here at every game that are ER trained, sports medicine trained. We're able to handle heart attacks, strokes, get people transported to the appropriate care. We even have the ability new this year to be able to have an isolation room for anyone that we suspect that is ill from COVID to get them out of the facility, get them quarantined, and do contact tracing if necessary.
And it sounds like you did kind of what we all want to do, which is go back to the ballpark, but also go back with some of the experience and yet do it safely. So talk to me a little bit about how you looked at this kind of the whole ballpark for health and safety.
Sure. Not only, getting back to the ballpark for, health and safety, I think it's good for the health of our minds too. Coming back to be able to participate, have fun, being able to do some of the things that have been kind of taken away from us for the last year is really important for our health and safety. In doing so, we had to follow all CDC guidelines, proper masking, proper social distancing, making sure that we limited capacity, worked with the ticketing departments to kind of develop some protocols to get our tickets so that we have everyone socially distanced, spaced out. We don't have anyone in consecutive rows. There's at least a row in between every seat. There's in between the groups that are tickets that are being sold. We have at least 3 seats in between. Worked really careful with Michael Schuster, the architect of the ballpark, to really kind of make sure that we had everything spaced out appropriately.
And as a sports medicine provider, this is a unique place, but is it, I gotta wonder, like the most rewarding thing you've done in years?
It is very fun. As a primary care sports medicine doctor, I try not just to take care of your torn ACLs, your broken bones. I really look from the medical aspect of sports medicine as well. And this year has really provided some very unique challenges. Developing protocols so that our local high school athletes can play, making sure that we can run the races when it's time to run the races, making sure that we can have fans in the stadium. It's a very rewarding experience.
We would love to know what you are talking about, coronavirus or anything health related on your mind. You can shoot me an email, hit me up on Facebook, or my Twitter address is @LBonis1.